What is appendicitis? Appendicitis is a medical condition that causes inflammation and swelling of the appendix, a condition that requires emergency medical intervention to remove it completely due to causing a number of life-threatening complications, including sepsis. An appendix is a small protrusion or sac located at the end of the large intestine, which is 5 to 10 cm long, and about the location of the appendix, it is located in the lower right side of the abdomen. The appendix is an organ of the immune system, as it contains specialized tissues that produce antibodies. However, the function of the appendix has not yet been fully determined. Types of appendicitis. There are two types of appendicitis, namely acute appendicitis. Acute appendicitis is the most common type of appendicitis, which occurs in a patient acutely and suddenly, the symptoms of which usually develop rapidly within 24 hours. It is important to evaluate and treat acute appendicitis quickly. If left untreated, the appendix may burst, which can cause serious and life-threatening complications for the patient. Chronic appendicitis. Unlike the previous type, the symptoms of chronic appendicitis tend to be relatively mild, and this type of appendicitis usually causes pain that lasts for several weeks, months, or years. Chronic appendicitis usually occurs after an individual has acute appendicitis, and it is not an urgent medical condition, but it is important to detect it and provide treatment to the patient. It can be dangerous if it is not treated. Causes of appendicitis. The cause of appendicitis, in most cases, cannot be determined, but it is possible that possible causes of appendicitis include blockage of the appendix opening, where hard stool is the most common cause of this blockage, but it can also occur as a result of enlarged lymphatic follicles inside the appendix, abnormal growths inside it, or infection with intestinal worms, hypertrophy of tissues in the wall of the appendix due to infection in the gastrointestinal tract or elsewhere in the body, having inflammatory bowel disease, exposure to trauma or injury to the abdominal area. As for whether there are drugs that cause appendicitis, studies are still proving this, including a 1992 study involving 84 participants that linked the use of non-steroidal anti-inflammatory drugs with an increased risk of appendicitis, especially in individuals aged 50 years and over. Also, in a recent study published in 2022, which included a review of 737,992 cases, through which new types of drugs that cause appendicitis were revealed, namely the following: barium sulfate, clozapine, tocilizumab, aripiprazole. Also, there are a number of factors that can increase the risk of appendicitis, which include the following. Although appendicitis occurs at any age, it is more common in adolescents and adults aged 10–30 years. The sex of the patient, since appendicitis occurs in males at greater rates than in females. Having a family history of the disease, the infection of one family member with appendicitis will increase the risk of infection of the rest of the family with it. Symptoms of appendicitis. Symptoms of appendicitis can include abdominal pain that begins around the navel and moves to the right lower abdomen, which intensifies when coughing or moving, or in the morning when waking up from sleep. Nausea and vomiting, loss of appetite, flatulence, constipation or diarrhea, inability to get rid of abdominal gases, chills and overheating. It is worth noting that the symptoms of appendicitis have in common with many symptoms caused by gastrointestinal diseases and other health problems, so the correct diagnosis should be obtained before starting treatment. How is appendicitis diagnosed? The diagnosis of appendicitis depends on the clinical examination or the signs and symptoms visible to the patient, such as fever and pain on the right side of the abdomen. The diagnosis is confirmed by the following procedures: imaging appendicitis examinations. Imaging tests that can detect appendicitis include ultrasound imaging, magnetic resonance imaging, Computed tomography of the abdomen, however, is not considered a suitable option for pregnant women. It is usually recommended after ultrasound or magnetic resonance imaging, X-ray imaging of the abdomen. These tests help detect the presence of any inflammation or swelling in the appendix, and they also reveal the presence of health problems that can cause symptoms similar to those of appendicitis, including the presence of an abscess in the abdomen, congestion and accumulation of feces, or inflammatory bowel disease. Laboratory tests for appendicitis. There is no specific laboratory test for appendicitis, but the doctor can order a number of tests to detect the presence of inflammation in the body or to exclude any health problem that causes symptoms similar to appendicitis, including examination of a complete blood count, which usually reveals an elevated leukocyte count, which serves as an indicator of inflammation. C. Reactive protein screening to exclude the presence of any intra-abdominal inflammation caused by immunological diseases or chronic diseases. A urine test in order to deny the presence of inflammation in the urinary system or infection with kidney stones. Pregnancy screening. An ectopic pregnancy can cause appendicitis-like symptoms. Differential diagnosis of appendicitis. As mentioned earlier, the symptoms of appendicitis are not absolute or ad hoc. Usually they may be caused by other diseases and health problems. For this, differential diagnosis should be carried out and exclude all other diseases, including the following: gallbladder problems, Crohn's disease, inflammation of the stomach, inflammation of the intestine, intestinal obstruction, inflammation of the bladder or urinary tract, kidney stones, ovarian disorders, including ovarian cysts, inflammatory pelvic disease, inflammation of the lung, intra-abdominal adhesions. Treatment of appendicitis. Appendicitis is considered a medical emergency, and the decision on surgery to excise the appendix is preferably made quickly if the diagnosis is clear. The operation to remove the inflamed appendix may include the laparoscopic procedure, which is considered the preferred treatment option for many cases of appendicitis, is less risky and faster healing for the patient. Open surgery is performed, but it is associated with several risks, and it is usually resorted to if the appendix bursts or it is difficult to reach it due to the presence of an abscess of tumors in the abdomen, or when appendicitis occurs in a pregnant woman in recent months. Also, the treatment of appendicitis may include the prescription of some types of antibiotics, which is usually carried out along with an appendix operation. But in some cases of simple appendicitis, the patient can respond to antibiotic therapy on his own.